रक्षा कवच बनाया। डॉक्टरों ने योग से खुद को भी मजबूत किया और अपने मरीजों
फोन वराது
வா
फोन
ஆயிடுச்சு வீடியோ வருதா
சரிடா
ഞാൻ നേരത്തുള്ള വീഡിയോ ഒന്നും എന്നോട് ചോദിക്കാണ്ട് നീ എഡിറ്റ് ഒക്കെ
Good morning, sir.
Good morning, ma.
Shall we start the session,
Good morning,
sir?
sir.
எல்லாம் வந்துட்டாங்களா? பண்ண டைம் இருக்கு.
Okay, sir.
Good morning, sir.
Good morning, Bhagavan sir.
Good morning.
Good morning, sir.
Good morning, sir.
Good morning. Ma'am.
Morning, sir.
Good morning, sir.
Good morning.
Good morning, sir.
Morning, sir.
Good morning.
Morning, sir.
Good morning, sir.
Good morning, sir.
Suprabhat, sir.
Good morning, sir.
Good morning, sir.
There is a contradictory always.
Namaskaram, sir. Namaskaram, sir.
Namaskaram. Ma'am. Namaskaram.
Sir, good morning, sir.
Good morning, sir.
Shalini,
Yes, sir.
உடனே அலோவ் பண்ணு எல்லாரையும் உள்ள.
Okay, sir.
Shalini, let us start.
Okay, sir. Good morning to one and all. On this beautiful morning, I'm very happy and delighted to welcome all of you for the Common Yoga Protocol demonstration on the celebration of 7th International Yoga Day being conducted by Faculty of Yoga Sciences and Therapy, Meenakshi Academy of Higher Education and Research in association with Indian Yoga Association, New Delhi. Let's start the session with starting prayer. May I request Mrs. KJ Sridevi, PhD scholar, FYST MAHER, to initiate the starting prayer.
Thank you, Shalini. Om Vakratunda Mahakaya Suryakoti Samaprabha Nirvignam Kurumi Deva Sarvakaryeshu Sarvada. Om Shanti Shanti Shanti. Om Sangatvam Samvadatvam Sambho Manam Shri Janata Deva Bhagam Yata Purve Sanjanana Upasate Sanjanana Upasate Sanjanana Upasate. Om Shanti Shanti Shanti.
Yeah, once again, I'm very happy to invite all of you for the Common Yoga Protocol demonstration on the celebration of 7th International Yoga Day. On this occasion, I'm very happy and to offer my heartfelt greetings to A.N. Radhakrishnan, Chancellor MAHER, and Mrs. Jayanti Radhakrishnan, Rector MAHER. I'm also very happy to invite today's chief guest, Professor Dr. R.S. Neelakandan, Vice Chancellor MAHER, Professor C. Kritika, Registrar MAHER. I also welcome our Honorable Professor and Head, Dr. R. Ilangovan, and our faculty members, Dr. S. Murugesan, Associate Professor, Dr. B. Subbulakshmi, Associate Professor, and Mr. A. Annadurai, Assistant Professor. Finally, I welcome all the PhD scholars and students of FYST and my dear friends and all the executive members of Indian Yoga Association. Now we are going to have the demonstration. May I request our Professor and Ed, Dr. R. Ilangovan sir, to offer the description for the Common Yoga Protocol with the demonstration being performed by Mr. A. Annadurai, Assistant Professor, FYST MAHER.
Good morning to one and all. Very happy International Day of Yoga to you all. Now let us going to have our program to be performed throughout the world at this juncture. I request you all to do the same what our Annadurai sir is doing. You have to do at your home also, and you follow the same procedure what he is going to adopt. So practical aspect is also much important. So be ready to do along with him. Thank you very much. Now let us again have invocation to enhance our benefits of practice. Om Sangasatvam Samvadatvam Sambho Manansi Janatam Deva Padam Yada Purve Samjanana Upasate Samjanana Upasate Samjanana Upasate. May you move in harmony. May you speak in unison. Let our mind be equanimous like in the beginning. Let the divinity manifest in our sacred endeavors. Now we are going to start our loosening practices. Another sir is going to do, you please follow. The first one is neck bending. He moves his head forward and backward. When you come forward, exhale. When you go back, inhale. Do it 2 rounds. Inhalation back, exhalation forward. Then we are going to go for this right and left bending, stretching. Inhalation, exhalation. When you come straight, inhale. When you go down, you exhale. 2 rounds you do. Now you have to go for right and left twisting. When you twist, exhale. When you come to normal position, inhale. Again 2 rounds you do it. Altogether 3 rounds you are doing. Now neck rotation. Forward and backward. When you go backward, inhale. When you come to normal, you exhale. So altogether 3 rounds. If you have done 1, then repeat another 2 rounds. Now shoulders stretch. When you stretch your hands up, inhale. When you come down, exhale. Altogether, do it 3 times. Now shoulder rotation. When you go back, inhale. When you come forward, exhale. Altogether 3 rounds. Now get ready for trunk movement. So these exercises increase your synovial fluid, stretch ligaments and tendons, promote immunity power, flushes out excess free radicals, thickness and quality of cartilage improved, flushes out excess calcium oxalate solidness. It decreases the extra production of cytokine protein and promote immunity power at these COVID pandemic difficult times. Such an extraordinary qualities that we are having by these exercises. By these loosening practices. Now we are going for knee movement. When you come down, exhale, go up, inhale. Exhale, inhale. 3 times you do, please. So many benefits are here. And now we are going to start asanas. First, we are going to do Tadasana, palm tree posture. You can stay in this final posture at 10 to 30 seconds according to your ability. When you go up, now inhale. When you come for normal, you have to exhale. 10 to 30 seconds. It provides stability, increases your height, good for pregnant women for the first 6 months because the ovaries are getting enlarged by more than 500 times than normal for pregnant women. Such an extraordinary asana this is. It corrects your faulty posture and spinal nerves. Next, we are going for Vrikshasana, the tree posture. This also, when you go up, you have to inhale. Again, 10 to 30 seconds, you have to be in this position. It activates all the 7 important chakras. It is all glands get balanced. It is like equivalent to running, and you change your legs also for better benefit. It improves neuromuscular coordination, balance, endurance, alertness, and concentration. Such an important and excellent asana, this Vrikshasana. Now we are going for Padagastasana. Pada means feet, Hasta means hands. When you come down, you have to exhale. Again, 10 to 30 seconds. It strengthens central nervous system. Abdominal organs are toned. Good for back pain and constipation. It makes spine flexible, improves digestion, and helps to overcome menstrual problems of the ladies. Slowly comes back with inhalation. Now he goes for Ardha Chakrasana, the half wheel posture. Ardha means half, Chakra means wheel. When he goes back, you have to inhale. Again, 10 to 30 seconds according to your willingness. Your spine flexible becomes good, spinal nerves and muscles are activated. It is very good for cervical spondylosis. And next he goes to Trikonasana. Trikona means triangle. When he moves down, he exhales. Again 10 to 30 seconds. It is a number one therapeutic asana. Makes the spine flexible, strengthens calf, thigh and base muscles, and improves lung capacity. Change the direction. Exhale and go down. Abdominal and reproductive organs are becoming strong by this asana. It is also good for back pain. Be maximum 30 seconds. When you come back, inhale. Now we are going for sitting postures. Bhadrasana. Bhadrasana means firm or auspicious. You have to be in this position for 10 to 30 seconds. It is good for urinary disorders and ovaries, keeps kidney healthy. It gives the body form and stability of your mind gets improved. It helps during pregnancy and release abdominal pain. It is often experienced during menstruation. It avoids abdominal pain if you do this asana. Next, we are going for Vajrasana. Slowly come back. You know very well it is one of the meditative posture, thunderbolt posture. 30 seconds you be with this position. Even after food you can do such a great asana. 72,000 nadis are activated. Good for digestion, good for thigh muscles and calf muscles. When you do all these asanas, you please close your eyes and do for better inner feelings. Better inward you can go. 10 to 30 seconds. Concentrate on the tip of your nose. Slowly come back. Now we are going to do Ardha Ushtrasana, the half camel posture. Ushtra means camel. When you go down, you have to inhale. Wait for 10 to 30 seconds. Good for back and neck muscles. Good for constipation and back pain. It makes your spine flexible. It corrects your body posture. Increases blood circulation to the head and cardiac region. Such an excellent asana this is. Now you are going for Ushtrasana, the complete camel posture. It resembles like a camel, hence the name. When you go back, you have to inhale. Again, do it for at the maximum 30 seconds. It is number one back bend asana. Very good for defective eyesight, good for back and neck pain, good for asthma. It reduces fat over the abdominal muscles and hips. It is good for digestion, good for cardiorespiratory system, good for reproductive system. All 9 systems are getting activated. Good for elders particularly. Hyperactive children, it is good. Good for ladies in particular. Now let us go for Sashangasana. When you come down, you exhale. It helps to reduce your stress and anxiety. Good for adrenal glands. It tones up reproductive organs, relieves constipation, improves digestion, and helps to relieve back pain. It tones pelvic muscles and sciatic nerves. Such an excellent asana this is. Next, we are moving for Uttana Mandugasana. Uttana means upright and Mandugasana means frog. There are so many benefits. Good for back and neck pain, muscles, avoids cervical spondylosis, good for knee joints, cues flat foot, improves diaphragmatic movements and lung capacity, very much needed at this COVID pandemic lockdown period. It strengthens ankles, good for heels. Yet another easiest and the best asana. Now we are moving for Vakrasana. That is the spinal twist posture. Vakra means twisted. When you twist, you do exhale. When you come to position, you have to inhale. Again 10 to 30 seconds. This asana helps to increase the synovial fluid in joints, promotes flexibility of the spine, stimulates pancreas. It is very good for diabetics, regulates adrenal glands, frees from wrinkles. It is anti-aging. Ever you will be young when you do this asana. It is good for urinary troubles and rheumatism. Now we are moving for prone postures. First, Makarasana. Now it is very popular during this COVID period. Very much needed for the sufferers, COVID-19, coronavirus sufferers. Throughout the world, most of the scientists and medical experts advising this asana to do when you are suffering with breathing problems. It is good for relaxation of the whole body. It helps in recovery of back problems. It counters stress and anxiety. Good for spinal nerves. Good for asthma, sciatica. An excellent asana. It is the need of the hour for COVID patients. Slowly come back. Get ready for Bhujangasana, Cobra pose. Bhujanga means snake or cobra. When you go up, you have to inhale. It relieves stress, reduces abdominal fat, relieves constipation, activates circulatory, digestive, nervous, and reproductive systems. It is very good for backache and bronchial problems. It awakens Kundalini Shakti, good for women disorders. It is one of the best all-round conditioner. It keeps your energy at cerebrum. That is the place what we call Sahasrara Chakra. Fully your Kundalini Shakti is activated from Mooladhara to Sahasrara and stored in cerebrum. Again 10 to 30 seconds. Slowly come down. Get ready for Salabhasana. Salabha means a locust. When you raise your legs, inhale. When you come back, you have to be in a normal position. Exhale. It is good for sciatica, lower backache. It reduces fat in the thighs and buttocks. Good in weight management. Spine becomes elastic. Helps to improve lung capacity. It is very good for digestion and inner organs. Now he switches over to Sedu Bandhasan, the bridge pose. Sedu Bandha means formation of bridge. When you go up, you have to inhale. Again 10 to 30 seconds. It relieves depression, anxiety, strengthens your lower back muscles, strengthens shoulders, thighs and wrists, stretches abdominal organs, improves digestion and relieving constipation, tones up the lumbar region of the spine and ankles. Such a great asana this is. When you come to normal, you have to exhale. Then you have to go for Uttana Padasana. When you raise your legs, inhale and raise. Always better to do with your breathing, the asanas. It expands chest wall, keeps the spine supple, balances nervous and particularly navel center. It is good for abdominal pain, indigestion and diarrhea. It tones up neck and back muscles and also effective to overcome depression and anxiety, and it activates thyroid glands. Then he moves to Ardha Halasana. When he lifts his leg, you have to inhale. Don't forget that you have to combine your movements with breath. It is good for constipation. It is very much beneficial to hypertensive patients, but they have to be under supervision. It regulates thyroid glands, balances metabolic rate, promotes immunity power, massages all internal organs. That is the speciality of this asana. When you come back, you have to exhale. Then you have to move for Pavana Muktasana, the wind releasing posture. When you tuck your legs, you have to exhale. It removes constipation, good for digestion, decreases the bloating sensation in the abdomen, and also it is good for impotence and infertility. When you come back, you have to be, the inhalation should be normal. Now have rest, relax your body at Shavasana. Shavasana is very good for hypertension, infectious problems, good for psychophysiological system. At the outset, all asanas are good for hormone segregation. Asanas activate cerebellum via basal ganglia for better movements, and gallbladder also good for better digestion, and it promotes in turn biological clock. Asanas assist better circulation of white blood cells, promotes immunity power, remove toxins in the body. It is asanas are wonderful drug for holistic health. Now he gets ready for his Kapalabhati. Passive inhalation and active exhalation. First inhale, then let it be passive. You have to see and you have to feel the active exhalation. Here you can have 30 rapid breaths, that means 30 strokes. When you exhale, your stomach should go in. How nicely he does. If you are very good, then you can go up to 120 times a minute. But here you do at the maximum 30 breaths, 30 rounds, 30 strokes. Twice you have to do. Good for cough disorders, sinuses, cleanses the skull and nasal passage. Good for asthma, regenerates the whole body, keeps the face glowing and vibrant. It strengthens the nervous system and tones up the digestive organs. At the maximum 30 strokes, twice in 2 rounds. Next, he goes to Nadi Shodhana Pranayam. Alternative nostril breathing. Inhale through left nostril, exhale through right nostril, inhale from right nostril and exhale through left nostril. Alternatively, you have to do. You can do 5 rounds at the maximum here. Lungs are cleansed. waste products are expelled, more oxygen goes into bloodstream, it balances the right and left hemisphere of the brain, it brings equilibrium between sympathetic and parasympathetic nervous system. Such an excellent pranayama practice this is. Now let us move on to Sitali pranayam. Sitali means cooling. 5 times you do. Roll the tongue from the sides to shape it as a tube. Inhale through that shaped tongue and close the mouth and then exhale by both the nostrils. At the maximum, you do 5 times here. Roll the tongue like a tube. Inhale, close the mouth and exhale. Change like that. It is good for body and mind, prevents hypertension. You get the power of the lasting skin of a snake. It is good for digestion. It destroys the orders of or disorders of liver and spleen problems. It is good for skin and the eyes. Next, he is going to do Brahmari Pranayam. See how he gives his sound. Inhale through your nose, exhale slowly with a sound, humming sound. Repeat it for 5 rounds. You can do Shanmukhi Mudra. There are so many benefits. Relieves stress, improves voice. It provides sweetness in speech. In general, pranayama practices remove toxins, cure all diseases, activates electrical activities, promotes Kundalini Shakti, balances earth, water, fire and air elements in the body, produce nitric acid for better oxygen carrying capacity, very much needed at these COVID-19 pandemic lockdown situations. So pranayama practices are really a treasure for the persons who are having some problems in health wise. Now slowly let us go for dhyana, that is meditation. Just concentrate on the tip of your nostrils. In general, meditation is the superior practice than other yogic practices. Activates your neurotransmission, activates circadian rhythm, biological clock, perfects the activation of genes, good for high BP, insomnia, and stress in particular. Increases your blood flow to the brain. It leads to thoughtless stage. Let the thoughts come and go. Just watch out your breath. Close your eyes, please. Chest up. Just observe your thoughts, your breath. Meditation improves your quality of life. It removes bias in amygdala. 35% of your blood flow can be increased. 32% of your oxygen consumption can be promoted. 43% of your telomere activity is increased. It increases the segregation of melatonin in particular, and in turn activates gallbladder, which is responsible for your wake and sleep state, circadian rhythm. Above all, it perfects your activation of genes. Thus, it promotes your soul. You will become a godly person, a noble person, a divine person. Thus, you can promote the entire society for its betterment. Slowly come back. Relax. Slowly open your eyes and see the floor first. Enjoy the silence. Enjoy the beauty of the life. So now you have to have Shankalpa. I will tell you in Manashika, you repeat it. I commit myself to remain in a balanced state of mind all the time. It is in this state that my development reaches its greatest possibility. I commit to do my duty to self, family, at work, to society, and to the world for the promotion of peace, health, and harmony. Now let us have Shantipada, end prayer. Sarvoe bhavantu sukhinah, sarve santu niranmayah, sarve bhatrani pashyantu, ma gashya dukkha bhavave. Om Shanti Shanti Shanti. May all become happy. May all be free from illness. May all see what is auspicious. May no one suffer. Om Peace, Peace, Peace. Thank you very much. Relax. Now we are going to enjoy the special address by our esteemed Honorable Vice Chancellor, Professor Dr. R.S. Neelakandan sir. A few words I will tell you before getting into this introduction. We, the Meenakshi Academy of Higher Education and Research, deemed to be university, we are having 29 institutions, having more popular programs like medicine and dental. Our field of yoga, faculty of yoga, has been established from the year 2019 and 20. Our thanks to management, Chancellor A.N. Radhakrishnan sir, and the Rector Madam, Mrs. Jayanti Radhakrishnan. The entire credit for the establishment of this faculty is relied more on our Vice Chancellor. Anticipating the faculty of yoga before its establishment, he started by having memorandum of understanding with so many very good institutions of yoga like S. Vyasa, Bangalore, and our Kanjipuram Sri Shankara Ayurveda College, and he prepared and he founded the best and important foundational aspects. Such a far-sighted Vice Chancellor we have in our midst. He is very popular across the generations. A great dental surgery expert with global reverence. A burning example of love and compassion. A living laboratory of education. A multifaceted personality. A great combination of education, dentistry, educational, dental, social, spiritual scientist he is. ஆளுமையும் தலைமை பண்புகளையும் ஒரு சேர பெற்றவர். மீனாட்சி பல்கலைக்கழகத்தில் ஒரு வரலாறாக திகழ்ந்து கொண்டிருப்பவர். டென்டிஸ்ட்ரி துறையில் ஒரு தன்னிகரல்லா தலை மகனாக திகழ்ந்து கொண்டிருக்கக்கூடிய, மதிப்பிற்கும் மரியாதைக்கும் பாசத்திற்கும் உரிய நம்முடைய வைஸ் சான்சலர் அவர்களை உங்களின் சார்பாக நாங்கள் வருக வருக என்று வரவேற்கின்றோம். அவர் துவக்கி வைத்த துறை இந்த யோகா துறை, துவக்கி வைத்த கல்லூரி இந்த யோகா கல்லூரி. இன்று இந்தியாவிலிருந்து பல்வேறு பகுதிகளிலிருந்து இந்த நிகழ்வில் நீங்கள் கலந்து கொண்டிருக்கின்றீர்கள். We express our sincere thanks to you one and all. Vice Chancellor sir, it is our duty to tell you that we are the most probably the only university having each and every day a yoga program on this occasion of International Day of Yoga. Within this month, around 30,000 people are benefited by our various programs through Zoom meetings, through live YouTube programs, live viewers, and also live subscribers. So we are reaching all out to the social and extensional activities. And our students and scholars, they have done more than 40 kinds of promotional activities for the betterment of the society. And we feel proud that you are the Vice Chancellor who started our yoga colleges. You are the first Vice Chancellor to start yoga colleges deemed to be university in Tamil Nadu. You are the first Vice Chancellor to start PG degrees in yoga among all deemed to be universities in Tamil Nadu. You are the first Vice Chancellor to start yoga therapy courses among deemed to be universities in Tamil Nadu. You are the first Vice Chancellor to start MPhil and PhD programs in yoga in Tamil Nadu. Such a divine person. We feel elated by your presence and we are eagerly awaiting for your giving blessings to all. Once again, on behalf of the participants, we extremely express our thanks to you and welcome you for this occasion. Thank you very much, sir.
Thank you, sir. Now may I request Mrs. KJ Sridevi, PhD scholar, FYST MAHER, to give guest introduction.
Thank you, Shalini. I am privileged to introduce the guest of honor today, Dr. R.S. Neelakandan, MDS IBOMS Fellow, IFH NYS USA. Professor Dr. R.S. Neelakandan is in the field of oral and maxillofacial surgery since 1987. He is an alumnus of Madras Dental College and had been adjudged the best outgoing student in his batch. He was commissioned dental officer in Army Dental Corps between 1980-1985, following which he resumed his post-graduation in oral and maxillofacial surgery at the same alma mater. On completing his post-graduation, he has trained in the Department of Plastic and Reconstructive Surgery at Government General Hospital, Madras Medical College for a period of 3 years. He had been an undergraduate and postgraduate teacher since 1990 at Meenakshi Dental College and Hospital. He has special interest in surgical oncology, reconstructive and regenerative surgery, and had advanced craniofacial and distraction osteogenesis training at Leipzig University, Germany. He has also qualified for fellowship in head and neck oncology, awarded jointly by International Federation of Head and Neck Oncologic Societies and Memorial Sloan Kettering Cancer Center, New York, USA. He has to his credit over 50 international and national publications and has also authored a manual on distraction osteogenesis. He has successfully organized and conducted over 80 lectures, hands-on workshops, and symposia jointly with Association of Oral and Maxillofacial Surgeons of India and National Association of Plastic Surgeons of India at various dental colleges throughout India. He has done extensive research in the field of distraction osteogenesis of the facial skeleton and the fruition of such pioneering work in his 3 patents for distraction devices. He was the executive committee member of the Association of Oral and Maxillofacial Surgeons of India before proceeding to occupy the prestigious post of the president of association for a 1-year term in 2016. He also served as the principal of Meenakshi Dental College and Hospital from 2015 to 2017. He was also the member of Advisory Committee, Senate of the Tamil Nadu, Dr. MGR Medical College, and currently Professor, Department of Oral and Maxillofacial Surgery, and the Vice Chancellor, Meenakshi Academy of Higher Education and Research, deemed to be University, Chennai. Thank you. Over to you, Shalini.
Thank you, Sridevi. Now, may I request Professor Dr. R.S. Neelakandan, Vice Chancellor MAHER, to address the gathering.
Thank you very much, Professor Ilangovan, for all those nice words. Esteemed dignitaries, faculty members, and my dear students, a very good morning to you all. It is a great honor for me to be here as the Vice Chancellor of this prestigious institution and address you all at this National Symposium on demonstration of common yoga protocol as part of online 7th International Day of Yoga celebrations organized by our own Faculty of Yoga Science and Therapy. Indeed, India has led the world in yoga sciences since its inception during the pre-Vedic times by the sage Patanjali. Today, in this hectic world, with all the physical and psychological stresses that has only been exacerbated with the present pandemic, yoga has gained a global popularity as a tool for the well-being of the mind and body, especially in the West. In 2016, yoga was added as an intangible cultural heritage by the UNESCO. So it is of no doubt that yoga science is recognized by the world, yet due to rapid westernization, this great Indian philosophy and lifestyle practice is a mystery to a large part of our society. So MAHER has been on the forefront of academic innovations since its formation as a deemed to be university in 2004. We have yet again come on the forefront of innovation by starting our Department of Yoga Science and Therapy, making us the first deemed to be university to do so. Our department not only provides programs in yoga like BSc and MSc, also doctoral in PhD Yoga Science. We also have the honor of having a memorandum of understanding with Swami Vivekananda Yoga Anusandhana Samastana, which is popularly known as Vyasa University at Bangalore, one of the leading yoga science institutes in the world, which allows for a transparent exchange of ideas, principles, values, and expertise. To conclude, I would like to remind everybody present here today about the unique opportunity you all have received to be a part of this conference. I urge all of you to make the most of it and apply the ideas shared here, not only in your practice, but also in your own lives. Thank you for inviting me to this workshop.
Thank you, sir. Thank you very much.
Thank you, sir. Now, may I request Mrs. K.G. Sridevi, PST Scholar, FYST MAHER, to deliver the oath of thanks.
Thank you, Shalini. Feeling gratitude and not expressing it is like wrapping a present and not giving it. I, on behalf of Faculty of Yoga Sciences and Therapy, Meenakshi Academy of Higher Education and Research, take this privilege to give vote of thanks. My sincere thanks goes to the organizing committee chief patrons, Mr. A.N. Radhakrishnan, Chancellor MAHER, Mrs. Jayanti Radhakrishnan, Rector MAHER, Mr. Ravi Tumuluri, Joint Secretary, IYA, patrons, Professor Dr. R.S. Neelakandan, Vice Chancellor MAHER, Professor Dr. A.M. Murthy, former Vice Chancellor, Tamil Nadu Physical Education Sports University, Chairman, IYA, Tamil Nadu Chapter. Additional patrons, Professor Dr. C. Kritika, Registrar MAHER, A. Annapurni, Treasurer, IYA, Tamil Nadu State Chapter. Convener, Dr. Professor R. Ilangovan, Professor and Head, FIST, Secretary, IYA, Tamil Nadu State Chapter. Organizing Secretary, Mr. A. Annadurai, Assistant Professor, FIST MAHER. And to dear coordinators, Dr. S. Murugesan, Associate Professor, FIST MAHER, Mrs. P. Subbalakshmi, Assistant Professor, FIST MAHER. And my special thanks to all the organizing committee members, scholars and students of FIST, executive members, IYA, Tamil Nadu State Chapter. My special thanks goes to all the participants who have made this program a success. Thank you one and all.
Thank you, sir. Thank you very much.
Once again, I request Mrs. K.J. Sridevi to end the session with ending prayer.
Sarve bhavantu sukhinah, sarve santu niramaya, sarve bhadrani pakshantu, ma paschet dukkha bhave. Om Shanti Shanti Shanti.
Thank you.
Thank you. Thank you, sir. Thank you very much.
Thank you, one and all. Sir, shall we conclude the session, sir?
Okay.
Thank you.
Thank you. Thank you, Ananda.